Review the healthcare provider's order, including the type of formula, the amount of formula, the infusion rate, the frequency and timing of feeding, whether to check residual volume prior to feeding, and the amount of water used to flush the tube. Explain the procedure to the child at his or her level of understanding. Wash your hands. Assemble the necessary equipment and place on a clean surface. Position the child either sitting or supine, with the head up at least 30 degrees. The most significant risk with tube feedings is aspiration of liquid nutrition into the lungs. Be sure the student is positioned properly, with the head elevated at least 30 degrees. Put on gloves. Observe the abdomen for signs of malposition or obstruction of the gastrostomy button, such as abdominal distension. If the student has abdominal distension, do not administer the feeding and contact the parent and healthcare provider. Remove the cap or plug from the gastrostomy button. If a residual check is ordered, attach a 60 milliliter catheter tip syringe with plunger to the end of the enteral tube. Unclamp the tubing and gently draw back on the plunger to remove any liquid or medication that may be left in the stomach. Note the amount withdrawn. Return the residuals to the stomach passively. Clamp the tubing and disconnect the syringe. Pour the formula into the feeding bag. Hang the container on the pole. Run the formula through the tubing to the tip and clamp the tubing. Place the tubing into the pump and set the flow rate. Open safety plug and insert the tubing into the gastrostomy button. Open the clamp completely. Program the pump to the prescribed feeding rate. When the single feeding is completed, clamp the feeding bag tubing and remove the adapter tubing. Attach the catheter tip syringe, unclamp the tubing, and flush the adapter tubing and button with the prescribed amount of water, or 5 milliliters. After flushing, lower the syringe below the stomach level to facilitate burping, if needed. Disconnect the syringe. Connect the plug to the gastrostomy button. Keep the child in a feeding position for at least 30 minutes after completing the feeding, if required. Wash the syringe, the feeding bag, and tubing with soap and warm water and put in the home container. The catheter tip syringe and feeding extension tubing can be used repeated times for up to 24 hours. Remove your gloves. Wash your hands. Document the assessment, interventions, and outcomes in the student's healthcare record. Follow up with the parent and healthcare provider as needed.